My name is Zohra,
And I'm Jason Hickey.
and we are from University of Calgary, Qatar. The title of our poster is Development of a Situated Learning Model for Teaching Medical Surgical Nursing Students in Qatar.
So we found that across the university there was a challenge for math instruction, and even after completing our foundations program and the English program, many students don't have adequate preparation in math and English. And when we looked at the literature, we found that that was a global issue.
So we decided to teach a clinical course utilizing situated learning approach versus a traditional approach. So we tried to create an authentic environment. We created a lesson plan incorporating situated learning strategies. In this approach, we did practice first and theory later. We had hands-on approach to teaching math skills, and we included a practical math exam.
So the first step that we took was to create an authentic environment, which is part of situated learning. So we started our course with 6 preclinical lab days. We used a simulation center. Should I keep going? Obviously not. But, so we used a simulation center to create the authentic environment. We created authentic patient scenarios. We used simulated patients to act out the scenarios. And we created hospital charts for every patient, including medication records with the same paperwork that they use in a hospital. We had sham medications that we used, and the students were responsible for providing care to the standardized patients.
So during that course, we created a community of practice utilizing the 8 situated learning techniques described here by McLennan. So we created the scenarios, the stories. The instructors were alongside with the students while they were giving care to the simulated patients, so there was coaching on the spot going on, and there was collaboration between the students as well as between the faculty as well as students. The students acted as cognitive apprentices where they learned from experienced teachers as well as from each other. They had opportunity for articulation of skills, previously learned skills to new skills in relation to the scenarios that were given to them. There were opportunities for reflection in action, as well as at the end of each class they had time to reflect upon what went well and how they could have improved. We had internet, they had their PDAs, we had the books available for them to refer to, and they had opportunities for practicing multiple times any skills that they want to practice with the simulated patients.
So we did some course evaluation. Students' reflections prior to starting the situated learning, they were skeptical and they had expected to do theory first and then practice later, but that's not the way that we did things.
Students' reflection after finishing the 6 preclinical days, some of them said that it made theory more relatable when they finally covered the theory, so they find the practice first was better. And they said that they would recommend it for future students too, that it was a great way of learning.
About halfway through the course, we did an online survey, just more course evaluation. And we found that all the students thought that the situated learning approach was engaging, beneficial, realistic, hands-on, challenging, interactive, and all but one of the students said that it was fun, which is rewarding for us.
So overall, we found that we were able to create a situated learning model for teaching preclinical classes for our students. It was an engaged pedagogy, and we were able to cover a wide range of things than we expected. So we think that it is beneficial in preparing them for actual clinical practice as well. Thank you.
Thank you.